Okay, so in this lecture we will talk about a topic that is dependent on the previous lecture or the physiology of the retina, which is the visual adaptation. So what is adaptation? Adaptation is a phenomenon of automatic adjustment of the visual sensitivity to a change in illumination. So let's just put this pen. Okay. So this means that when you are in a dark room or when you are in a good illuminated room, your retinal sensitivity will not be the same. There will be a difference in the retinal sensitivity. This difference will be according to the amount of illumination around you. So when you are either you are in a light room or in a dark room, this will be a difference in the retinal sensitivity. And this can be easily observed when you are going to the cinema. So if you are going to the cinema and you were in a very brightly illuminated outside and suddenly enter in the cinema as it is a dark room, in the first instance you will see nothing. You will not be able to see anything, the chairs and where your footstep. But after a while, in a short period, you will figure out everything slowly. So you will be able to see things in a gradual manner until after some time you will be seeing clearly, not as the bright illumination, but you will be seeing in much more details. And the reverse, when you are sitting in the cinema and in a dark room and once you get outside, so once you are in a light room, you will find that you can see everything immediately. You didn't need that much time to accommodate or to compensate for the dark vision in case of light vision. So if you are in a dark room and suddenly exposed to bright light, this darkness is exposed, or this darkness is broken immediately by this bright light. So why does this occur? Why in the first example we took some time in order to see things in darkness, and in the second example, we see everything immediately after transferred or after going from dark to light. This is because of the difference in the retinal sensitivity, and this is what's called adaptation. In order to understand the adaptation, we need to understand a term called the threshold and its relation to the sensitivity. So what is a threshold? The threshold of light, having what's called absolute threshold of light, this is the minimum stimulation needed to detect a particular stimulus. So if we decrease the intensity of light, how much or how less intense is the light for you to able to detect it? This is called the absolute threshold. For example, if the observer is seeing this light and it increases in intensity, and we ask him, okay, tell me when you can see this light. In the first case, he said, no, it is no, it is no again, and yes, I can see here. And yes, of course, I can see this because you increase the intensity. So here is what's called absolute threshold. So it is when the observer the first detect the slightest or the smallest intensity of light, this is called the absolute threshold. So this should be compared to what's called differential threshold of light. So what is the differential threshold of light, which will be the base of the light adaptation? It is the smallest difference in the intensity, which just to be appreciated when the stimulus is varied. So we are not testing if the examiner or if the observer is seeing or not, but we are testing if the observer can detect if there is any slight change in the intensity of light. So for example, if we are presenting this lamp and asking not if you can see, but if you can see the difference between this and say no, this and this, no, this and this, no, This and this, no. But when we present this stimulus and this stimulus, he can now say, yes, I can see that there is a difference between this one and this one. And this is called the differential threshold. So the differential threshold is when when you are able to detect a difference in the light. For the vision, if we are talking about the visual threshold, it is the minimum amount of energy required for a patient to detect a stimulus. So this means that there is an inversely proportionate relationship between the threshold and sensitivity. So if we are decreasing the threshold, and so that we are decreasing the intensity of light and the patient can see it, then this means that patient has high sensitivity or the retina is very sensitive. So decreasing threshold meaning that there is high sensitivity, and so the threshold will be inversely proportionate to the sensitivity. And if the patient has high threshold, it means that we need to increase the intensity of light very much in order to see it, then this means that the patient has low sensitivity. The threshold itself has a photopic component and scotopic component. So there is a threshold for light in the day condition, and there is a threshold for light in the night condition. So what is photopic threshold? It is a threshold of a patient measured in bright light condition, like in a sunny day. So if you are in the morning and the patient, or you bring the patient in a room, this room is illuminated, and you ask the patient what is the slightest illumination that he can detect, then this is the photopic threshold. Scotopic threshold as well. What will be the threshold of a patient measured in the dim light condition or at night? So the slightest amount of light that he can detect will be the scotopic threshold. And here we come to Purkinje. Purkinje is a scientist that discovered many things in ophthalmology, like you may remember the Purkinje sense on images and the others. Purkinje said or discovered that there is a change in the retinal sensitivity in the day and night, meaning that the cones or the retina, it change their sensitivity or change in the color sensitivity as we are changing from the scotopic to photopic condition. For example, in case of photopic, or if you are in the daylight, the wavelength of 507 nanometer will be the most sensitive, or the retina will be the most sensitive to the light of longer wavelength, which will be around the red and blue. So in case of photopic, or in case the red here will appear much brighter in the photopic condition, because the photopic will be, according to the Purkinje shift, the retina shift its sensitivity in the case of the day vision to the around 500 nanometer. So check this picture and check the illumination, so you can see that the red appears better. But check here, and if this is the same picture, but if you are viewing it at night, when you are viewing the same picture at night, again the retina change its sensitivity, so it will be more toward the wavelength of longer wavelength, of shorter wavelength. So light of the wavelength of 555 nanometer will appear brighter than the other stimuli. So let's say, for example, or let's say collectively, that in case of the daylight, the light of longer wavelength appears brighter, while in case of night, the light of shorter wavelength appears brighter. So it's just this is, I don't think that's, I need to just revise these numbers. I think that there is something with it, but just remember that the photopic, it is the longer wavelength, and in case of a scotopic, it is the shorter wavelength. This is called the Purkinje shift phenomenon, changing of the retinal sensitivity in order to be more sensitive from the long to shorter wavelength. Okay, this is just an introduction before we talk about the adaptation. So for the adaptation, we have two types. We have the dark adaptation and we have the light adaptation. So what is the dark adaptation? Dark adaptation is the ability of the visual system, both of the rods and the cones, to recover sensitivity after exposure to light. So we said in the previous lecture that after exposure to light, the rods and the cones will undergo bleaching or decomposition of the visual pigments in order to initiate electrical signal that will transfer the visual impulse. So this is in the light. So what happens when we are in the dark? So if we are in the dark, now the retina has bleached photoreceptors. So the photoreceptors need sometimes for regeneration of their visual pigments in order to be able to see in the dark. This recovery is faster in the cones, but the absolute level of sensitivity is greater in the rods. So here is the crucial sentence. So the cones has the ability to recover faster than the rods. So once you are in the light room and you are enter into a dark room, you initially see by the cones. However, although the cones work here because they have the ability to recover their visual pigments faster, but the problem here is that you will not be able to see much more details as you go through the time by the cones because they are not very sensitive. But as we said in the last lecture, the rods are much more sensitive. So here comes the rule of rods in order to increase its sensitivity as you stay in the dark room for longer time, and eventually you will be able to see much more details by the rods. So the cones enabled you to see rapidly, but the rods enabled you to see at more specifically or with more details. The rise in the visual sensitivity which occurs in the dark is due to regeneration of the photosensitive pigment. So this will lead to formation of what is called the dark adaptation curve. So what is the dark adaptation curve? This is a curve which is plotted the time in minutes in the horizontal axis and the threshold intensity in the vertical axis. So as we said, the threshold will be disproportionate to the sensitivity. So if you see that this is a high threshold and this is the low threshold, this can be the low sensitivity and the high sensitivity. So what does this curve mean? Immediately after the onset of darkness, there is an initial rise in the sensitivity or decrease in the threshold luminance, which reach plateau about 5 minutes. As we stay in the dark, the cones start to decrease to increase its sensitivity or decrease its threshold. So here the cone's threshold was high. So initially the cones decrease its threshold in order to see the illumination or to see the details of the dark room because they have the ability to regenerate their visual pigments faster. So they decrease their threshold, decrease and decrease and decrease until about 5 minutes they reach a plateau. So the cones cannot decrease their sensitivity or decrease the threshold further, or they cannot increase their sensitivity further because this is its limitation. So at 5 minutes, the cones cannot decrease its threshold and will start to make a plateau, and this threshold remains constant for 5 minutes. And then after 5 minutes, well, the rods now is alerted that there is a problem. Okay, we need to increase the sensitivity more, or we need to decrease the threshold level more. At starting from the 5 minutes, the rods was starting to regenerate its rhodopsin. So as it's regenerate its rhodopsin and it is formed, the visual pigment of the rods are formed. So there is increase in the sensitivity of the rods. And from here it takes the curve from the cones. So at about 10 minutes, which is a point called the rod cone break, the rods decrease the sensitivity or increase the sensitivity further or decrease the threshold further for 10, 15, 20, 25, 30, like about 40 minutes. So the maximum sensitivity of the rods is about 30 to 40 minutes, which is the maximum sensitivity of the rods, as this is the most sensitive visual pigments in the retina. So when you are seeing or staying in the dark room, you know you can't reach the full details, or you cannot see the full details of this dark room unless it is about 30 to 40 minutes you are staying in this room, because at this time the rods have reached their maximum sensitivity as all the rhodopsin is regenerated. So the first rapid recovery is attributed to the cones, and the later much slower recovery is attributed to the rods. And the kink between both of them and the cone plateau between the cone plateau and the rapid cone rod recovery is called the red cone break. So I guess it is understandable and it is logic. So again, here, this is the same curve, but it is plotted against the sensitivity. So as we are moving from the light room, so in the light room, the photoreceptors are bleached so that we don't have visual pigments. We need some time for regeneration. What happens faster? It is the cones. So the cones start immediately, as the cones here will having a much higher sensitivity initially than the rods. So the rods, it takes a very long time to regenerate their photoreceptors, but the cones regenerate their photoreceptors immediately, or regenerate the visual pigments immediately. So it decrease the sensitivity, and we can now increase the sensitivity, and now we can start to see the details of the dark room by the rods. So as the time occurs, there is an increase in the sensitivity of the cones, but very slowly or very gradual. Until it's about 5 minutes, the cones cannot increase its sensitivity further, and at 10 minutes they reach a plateau, so we can now reach the maximum cone sensitivity. We cannot increase it, so the cones cannot increase its sensitivity further. During this 10 minutes, the rods was trying to increase its sensitivity. That takes longer time, but it takes a maximum, or it has better and more duration. So the cones at the red cone break at about 10 minutes, the rods continue to increase its sensitivity at 10 and 15 and 20 and 30 minutes until they reach their maximum sensitivity at about 30 to 40 minutes. So we need to know what are the factors that may affect the dark adaptation function. What are the factors that may change the shape of the curve of the dark adaptation? First of all, the pre-adaptation light intensity. How much intensity of the light you were staying at. So if they are staying at a very intense light room, this will cause bleaching of the whole photoreceptors, or bleaching of the whole visual pigments. So a biphasic curve will be seen. So you see the same curve that we just mentioned, that it will be formed by both the rods and the cones, because both of them are bleached. But if the pre-adaptation light is weaker, then this will cause negligible photopigment bleaching. So there will be a faster recovery, and the rods will be more sensitive than the cones, leading to monophasic function. So if you are staying in a small or a moderately illuminated room, this means that this moderately illuminated room will cause less bleaching of the rhodopsin, so that not all rhodopsin is malfunctioning, or there is some rhodopsin is functioning, or there is some rhodopsin which is working and has unbleached rhodopsin. So when you are staying in dark, this unbleached rhodopsin will work immediately. So you don't need the cones to be working, or you don't need the cones to be functioning, as the rods will be more sensitive, and you already have some reserve of the rods. That's why this will lead to a monophasic function or monophasic curve formed by the rods only. So if you have, if there is increased intensity of the illumination, there is increasing in the bleaching of the photoreceptors. This will lead to a biphasic curve formed first by the cones, then the red cone break, then formed by the rods. But if there is decreased bleaching of the photoreceptors, and since the rods are much more sensitive, they will not start to decrease their intensity in order to be able to see in the dark. But we have already some sensitive photopigments or some sensitive rods that are working and don't have bleached rhodopsin, so they work immediately without the need of their cones, so that they will make a monophasic curve formed by the rods only. The second reason, or the second item that will be change the level of adaptation, will be the retinal location. As if you are stimulating the retina will be different from stimulating the periphery. As the fovea in sensitivity increase about 10 to 20 times rapidly for the first 20 seconds. Then the process stop after 10 minutes because we have only cones in the fovea. So the fovea will be much more sensitive to the dark. So as it has a cones, and the cones are more sensitive at the start, then or are more able to regenerate their visual pigments more rapidly than the rods. But this process will, or this sensitivity of the fovea will increase until certain limit when it reaches plateau after 5 to 10 minutes. While the retinal periphery is much more sensitive than the central part because rods are more prevalent in the retinal periphery. Also, the pre-adaptation light wavelength is important and an important determinant factor for the character of the adaptation curve. Meaning that if the patient is staying in a dark adaptation, if the dark adaptation is measured with the longer wavelength, it is monophasic, resembling the cone function. So, if, for example, if the patient is staying, if the patient is staying at the light room, or this light room stimulated by light of longer wavelength, or red light, then this will cause that the light will be monophasic, as the response will be of the single photoreceptor only, as it will be responsible for the cone function. But as the wavelength decreases, then the rod will show the greater sensitivity. So let's say, for example, that this will be if you are staying in the light room and then enter the dark room, and this dark room you will see a red light. Well, this red light will stimulate the cone function because there is a difference in the spectral sensitivity between the dark and the blue. The dark here, or the blue is a shorter wavelength. Okay, if you are staying in the dark and now entering into a light room, if you are staying in the light, then entering a dark room, this will increase the sensitivity of, and you are stimulated by a red light. This will cause a stimulation of the cones, because the cones are much more sensitive to the red light, which is of longer wavelength. But if you are staying in the light room and enter a dark room, and then during the dark room you are stimulated by the blue light, then the blue light will stimulate more the rods. So it will be stimulating the rods will be more sensitive toward the light of shorter wavelength, so that this will cause the rods will show greater sensitivity. Here we can see there is a difference in the spectral sensitivity between the different wavelengths. So the blue light here will show the sense will have a 400 nanometer, or around 400 to 450 nanometer of peak sensitivity, while the red light, it is more toward the 600 or 700. And as you can see here, the rhodopsin is much more sensitive to the yellow light. You remember when we were talking in the last lecture why the yellow signs of the traffic signs are in the yellow color? Because the rhodopsin in a dark adapted eye, it will be much more sensitive to the yellow light. So let's say, for example, this is a curve in which there is a difference or different illumination using different colors. So if the stimulus is high, this is a curve between the minutes in dark and the threshold. So we know that the threshold can be high or low, and there is an inversely proportionate relation between the sensitivity and the threshold. So what happens if we stimulate the patient with a red light? Well, the red light here will stimulate the cones, so it will show immediate response, but guess what happened? The curve is monophasic. You see this R1? The curve is monophasic because only cones are stimulated, so that the patient is now is functioning by only the cones, as we are stimulating the retina by only red light. So the only cones are responsive, and the cones has been able to regenerate their visual pigments faster, but they cannot decrease their sensitivity, or sorry, they cannot decrease its threshold or increase its sensitivity further. But as we increase, or sorry, we decrease the light of, or making or stimulating the patient with yellow or green or violet light, which is of shorter wavelength, you can see that the curve is taking the biphasic component. So there will be initial cone response followed by rod response. So the sensitivity increased with the amount, or with the change of the color of the light. Also, we can so here you can see that this is if we are using the blue color or the light of shorter wavelength, this will lead to initial will cause the rod response, or the rods to be maximally stimulated, while if we are using a light of longer wavelength like the red, this will cause the cone to be stimulated. And we can use this to isolate any one of them. Let's say for example, if the patient is staying in the pre-adaptation light, or if the patient is staying in blue light, or in a room which has a blue light, this blue light has a shorter wavelength, and this shorter wavelength will stimulate the rods. So what happens if the patient now enter into a dark room? So all the rods are bleached because they are all consumed as he was staying in the blue room. And when it is entering the dark room, he is now working by the cones only. So the cones have higher threshold, and they have low retinal sensitivity. That's why the patient will be only the cones doesn't have excess retinal sensitivity like the rods, so that the patient will be able to see immediately, but with few details, because he only working by the cones. This will be the reverse if the patient stay in the pre-adaptation light, which has a longer wavelength. Let's say, for example, that the patient is staying in a red room. In this red room, the patient has the light is only stimulating the cones, because the cones are more sensitive to the red light. So when I enter the dark room, in the dark room now the rods only are working. So in this case, the rods have lower threshold and have much higher retinal sensitivity than the cones. So in this condition, if the patient was under red illumination and then enter a dark room with his rods preserved, then this patient will have much higher retinal sensitivity and will be able to see in dark much more better, because he has all his visual pigments, all his rhodopsin present in place with no bleaching of the rods. So if there are different occupation like pilots who need to see well in the dark, these individuals, their occupation necessitates that they should see clearly in the dark and can detect the single photon of light immediately. That's why these individuals like wear this red goggles. So these red goggles will be an application of the dark and light dark adaptation. So by wearing these red goggles all the day, all the cones or the all everything that they can see will be sensitizing the cone visual pigments, because they only see the red color, so that their visual pigments or the rhodopsin in the rods will be preserved. So when they are in the plane or in their occupation, which needs a very good dark vision, they will be able to see clearly because the rods are preserved, or the visual pigments of the rods are preserved, and their retinal sensitivity is high. The pupil size also has a role in the dark adaptation, because as we have more darker pupil, this will admit more the light, so it will be going so that the curve will be much shorter, as it will allow more light to enter inside the eye. The fatigue and the age, so the our ability to see in the dark will increase will decrease with age and decrease with fatigue. As we get older, the threshold increase, and our retinal sensitivity also decrease with age and fatigue. So here we come to what are the characters of the night vision. There are some advantages of night vision, and there are some other disadvantages. The advantages is that clearly that we have much more light sensitivity. So the retina become much more sensitive, because the rods are regenerating, and the visual pigments of the rods are reforming again, so that we are and the rods by its nature has its higher sensitivity than the cones, so we can see in much more details. But the problem here is that it is a fragile, meaning that with a single photon of light, this can break all this darkness or this bleaching. So if there is a single photon of light, can cause bleaching of the rhodopsin in the rods. So what are the disadvantages? The disadvantages mainly in the night vision that the cone does not function. This will result in some consequences. First of all, the visual acuity is very low, because the central fovea is not working. And the best visual acuity will be attained by the paracentral vision, where the rods start to be present. There is a nocturnal myopia of about 1 to 1.5 diopter. This is because the accommodation reflex is starting from the fovea, and it is insensitive in the dark. So remember that this patient who has his eye has his fovea, which is insensitive to the darkness. So this patient will try to accommodate, because his eyes are assuming that there is an object which is present closer than the infinity. So that because he cannot see well in the dark, so the lens starts to accommodate, as the lens and the eye think that there may be an object in the near. So this will result in some nocturnal myopia. So you may figure this out if you are in the dark room, and you are stretching your hands in front of you and trying to locate the objects, so that you are not stumbling with anything. You will, if we try to measure your accommodation at that time, we will find that you are slightly accommodating, because you are considering that there is something in front of you, but you are not able to see it. So the lens starts to accommodate. Another problem is that the visual field shows the central scotoma. Scotoma meaning that there is a visual field effect. And this visual field effect will be about 2.5 degrees, which is representing the central foveal cones. So the peripheral field is normal, but there is a central visual field effect due to that the cones are not functioning. And the color vision, of course, will be absent. Also, there is a Purkinje shift phenomenon. So there will be a shift of the retinal sensitivity to the lights of shorter wavelengths, as the retina becomes more sensitive to light of shorter wavelength. And there is night myopia. Why there is a night myopia? Because there is chromatic aberration and spherical aberrations. You remember that in the night the pupil dilate. So when the pupil dilate, it will allow the peripheral rays to enter through the eye. And the peripheral rays will cause blue light to be focused in front of the retina. So it will form an image in front of the retina, lead as in case of myopia, and also the spherical aberrations, as the peripheral rays will be focused in front of the retina, so it will cause like myopia, or as if the patient is myopic. This occurs only in the night. So these are the consequences of the night vision. Let's summarize again. The visual acuity is very low. Nocturnal myopia of 1.1 to 1 point diopter. Visual field scotoma or central scotoma of 2.5 degrees, absent color vision, Purkinje shift phenomenon with a short wavelength, and finally night myopia due to spherical aberration and dark and chromatic aberration. Do you have any question in the dark adaptation? Okay, Dr. Safa is asking about the nocturnal myopia. Or you mean the night myopia or the nocturnal myopia of 1.5? Okay, so when we are, let's say for example, that you are here. You are now entering into this dark room. Okay, so there may be a table, there may be a television, there may be a chair. So when you are looking or you are entering inside the dark room, you find that different objects that you cannot see. So when you are entering this dark room, you will try to look your way as you go or as you navigate through this room. In such a condition, you should, if the light is on, you should see these targets as a distant target. So you shouldn't accommodate, and these are distant targets. But as you are entering in this dark room and you cannot see, the brain is assuming that there are some near targets in front of him, because the fovea is not working, because it is insensitive in the dark. So the brain assumes there is some close object like this. So the send impulses to the lens in order to accommodate, in order to try to figure out if there is any obstacle or any problem or anything in front of you. So this will result in this myopia, that the lens increase its power about 1 to 1.5 diopter to try to see in the surrounding 1 or 2 meters around you. Is this clear? Dr. Soham is saying pirates closing one eye is also example of dark adaptation, correct? Well, we can consider it okay. So yes, I don't think that there is any problem with that. So dark adaptation shouldn't be binocular. It can be uniocular. So if there is someone who is closing one eye, and then this eye is exposed to light, then the rules of dark adaptation will apply here. Yes, Dr. Amira, we are, but Dr. Swam is talking hypothetically, so usually pirates close their eyes because they are lost. But remember this piece of information for the exam. You may be asked about it. Okay, you're welcome. So now we talk about the light adaptation. It is light adaptation is much more difficult to understand and not very well explained in books and even in real life. Um so it is something vague or not very well understood like the dark adaptation, but we will talk about what we know about it. The light adaptation is the reverse or is the same idea about dark adaptation, but on the other way around. Meaning that if we are in the dark, the retina starts to increase its sensitivity in order to see the things clearly. The reverse occur while you are staying in the light. So if you are staying in a dark room and suddenly go to the light room, you will find that you are closing your eyes immediately, especially if the light is intense. And why does this happen? This because your eyes was darkly adapted. So your sensitivity are the highest. You have the highest sensitivity now. And once you enter a light room, your eye cannot compensate for this too much illumination for its sensitivity. So you try involuntarily to close your eyes, and this what happens in the light adaptation. So if we are talking in the dark adaptation that the retina increase its sensitivity, in case of light adaptation the retina decrease its sensitivity in order to adjust for the high or intense illumination that's present. So with dark adaptation, we noticed that there is a progressive decrease in the threshold or increase in the sensitivity with time in the dark in order for the visual pigment to regenerate. But in case of light adaptation, we have full regenerated visual pigments, and the eyes has to quickly adapt to the background illumination to be able to distinguish these objects in the background. So if you are entering now a white room or an illuminated room, you will see that there are some objects in this illuminated room, and these objects are against illuminated background. So suppose that you are entering the same room again. You are here and you are entering this light room, and this light room is from the lamp present in the ceiling, and there is a television and there is chairs and there is tables. So you are now entering from dark to light. Your retina is very sensitive, and you are entering now. So your sensitive retina should decrease its sensitivity or increase its threshold in order to see these objects like television or the table or the chair against the background illumination formed by this source of light. So this is the idea of light adaptation. In order to discover or in order to study the light adaptation, this can be done by what's called increment thresholds. So the threshold should change by a certain amount or certain increments in order to calculate how can we differentiate between the background illumination and the object illumination. So we do what's called increment threshold experience or experiment, in which a test stimulus is present on a background of certain luminance. So we put a background illuminance, we put here like a lamp or like a source of light. This light has a certain intensity of light, and this background has another intensity of light. Then we increase this stimulus, or we increase the intensity of this stimulus until the patient or the observer can detect that there is a difference between the intensity of the stimulus and the background intensity. So what do we call this? What do we call this type of threshold? We said this in the first slides. If we are comparing the threshold between a test stimulus and surrounding background, so we know we want to compare between the intensity between both of them. Yes, it is something like relative or the differential threshold. So this is the principle of the differential threshold. So as we increase the intensity, there is a background stimulus and there is a test stimulus. If the patient or if the observer can detect the difference between the test stimulus and the background stimulus, this is the differential threshold or the relative threshold. So here we have independent variable, which is the luminance of the background. So the luminance of the background is remain the same. And the dependent variable is the threshold intensity. So we put a lamp like here, like a lamp that we can increase or decrease its intensity in increment, so that we can, like, for example, like 5, then 10, then 15, then 20, until the patient is able to detect the difference between the test stimulus intensity and the background stimulus and the background intensity. And this is the principle of the visual field in practice. So all of us know what is this device. This device is what's called perimeter or the visual field analyzer. In this device, there will be representing a background illumination, like whitish illumination, and there will be a test stimulus like a dot, and the patient will be required to see will be grasping a device that will be clicked, or he can click on it when he can see this stimulus or he can see this dot. So this dot is illuminated and it will be against a background illuminated bowel. So if the patient can appreciate the difference between the illumination of both, then this is considered an application for the light threshold or application for the light intensity or light adaptation curve. So in light adaptation using increment threshold test, there will be a background illumination and there is a test stimulus which can be increased by increments. So let's, for example, this will be the intensity of the background illumination and this is the intensity of the test stimulus. As we increase the illumination or increase the illuminance, now it will be this is the background illumination, which should be the same, but the increasing the intensity of the luminance is now appreciated by the patient. So the patient is now can detect the difference between the background illumination and the test stimulus illumination, and this will be the base of light adaptation curve. This appreciation of the difference is due to decreasing the sensitivity of the photoreceptors, as we can see now. So the experimental conditions can be repeated by changing the background field luminance. We can change the background field luminance if we want. And depending upon the choice of the test, the background wavelength and the test size and the retinal eccentricity, there will be a monophasic or biphasic threshold versus intensity curve is obtained. So here is the light adaptation curve. The light adaptation curve is a curve which will be, or in this experiment that we are talking about, the test stimulus was a yellow test or a yellow color. And the background illumination was green color. So we put a test background of green color and the test stimulus of yellow color, and then as we increase the intensity of the yellow color, this will result in a response. This response is making a curve. So let's analyze this curve as we did in case of the dark adaptation curve. The lower part of the curve is belonging to the rods, while the upper part of the cone is belonging to the cones. Then, As we increase the background illumination, here is the background illumination now, it is increased. There will be a shift from the rod system to the cones, leading to formation of this biphasic curve or dual curve as it is present in the case, or it's present in the dark adaptation curve. So here we have two curves. The two curves are by changing the intensity of light in the test stimulus and changing also the intensity of stimulus of the background illumination. Again, this is a light adaptation curve plotted against. This is the log of the background illumination intensity. Here it was 0, so as we increase the background illumination, and here we increase the threshold of the stimulus. So the threshold or the threshold, this was the least or the less, and this was the high, was 8. So as you can see from the first instance, the threshold was high. Then the threshold started to decrease by the rods and the cones, as we will see forming this curve. In the adaptation curve, the curve is between the log of the stimulus and logarithm of the background intensity is undergoing 5 phases. Let's analyze each one of them. 3 and 4 and 5. The first one, or the first 4 are belonging to the rods. So all these are due to rods. The first one, the second one, the third one, and the fourth one are belonging to the rods. These are the scotopic portion. So the rods here, since they are very sensitive, they start to decrease their sensitivity or increase their threshold in order to decrease the amount of light entering or stimulating the eye by different stages. The first stage, or the section 1, detection is limited by the neural noise in very low level that is called the dark light. What is meant by dark light? When the patient is entering a light room, in the initial stage there will be no vision, but there will be some electrical impulses like the photoreceptors. There is some phototransduction within the photoreceptors, but these electrical charges are not large enough in order to initiate an electrical current that will pass through the neural retina. So since that there is some electrical changes, this is called light, but since that it is not perceived by the patient, it is called dark. So this is like some neural noise, some changes in the electrical potential in the retina under the initial exposure of light, and this is not perceived as light. Then the section 2, like here, it is in case of the background illumination is very dim. When we are doing the test with dim background, there is a fluctuation in the light source plays the primary role in determining the threshold, meaning that by increasing the threshold of the stimulus, the patient will be able to detect it if it is fluctuating. So as we increase it here, from here to here to here to here, there will be increasing in the fluctuation of the light stimulus, and the patient will be able to appreciate this light as long as it is fluctuating. And this only occurs because the background illumination is very dim. So this is called the section 2. In section 3, which is this one, you can see that there is, according to the Weber's law, threshold constant remains, or the threshold constant remains constant as the illumination changes. So as here, we can change the illumination, but there is a change in there will be a fixed, or the illumination, the threshold does not change, and this according to the Weber's law. So what's the Weber law? Weber law, meaning that it is a law, it's a physical law that will determine what is the minimum amount of percentage, or what is the ratio of change in order to receive the difference. Meaning that how much change in the light we should change in order to be received the difference. This was calculated as 8%. If I put at one hand 1 kilogram, and the other hand 1 kilogram, or 1,000 gram and 2 grams, will be able to detect which hand appears much more, which one is more heavier? No, because the difference is less than 2%. According to the Weber law, the difference between two weights should be more than 2% in order to detect the difference, and the tone to be 3%. So the same thing applies for the light intensity curve. In order to detect the difference between the light as a stimulus and the light in the background, there should be a difference. And the difference here, or according to this law, the threshold here remains constant as the illumination changes, because the difference here doesn't reach the limit by Weber's law. Then all this was the effect of the rods. So the rods here are doing the first stage, the second stage, the third stage, and fourth stage. While then the fourth stage here, as we increase the background illumination, this will lead to complete bleaching of the photoreceptors. And then the rods cannot detect any stimulus, because all the visual pigments or all the rhodopsin is bleached. So when does the rod desaturation occur? This is occur when the 10% of rhodopsin is bleached. So as 10% of the rhodopsin is bleached and or more, there will be no ability of the rods to detect any difference between the background illumination and the antenna or the stimulus illumination. So from here, the cones take the initiative and complete and decrease the sensitivity or increase the threshold furthermore. So the stage 5 here is the function of the cone. So this makes the photopic portion of the curve. The final part of the curve is the function of the cones, which will cause much more decrease in the sensitivity and much more increase in the threshold, in order to decrease the sensitivity of the retina furthermore and to seek better in the illumination. And this occurs at or reach at this level like about 10 minutes. So compared to the 30 to 40 minutes of dark adaptation, the light adaptation curve takes much less time. So the mechanism of light adaptation, the photochemical reaction in which the rhodopsin is converted to retinal and opsin. This occurs, or the rhodopsin, the retinal and opsin is, and this will be in the dark. The retinal and opsin will regenerate to form the rhodopsin. Under the exposure to light, rhodopsin will be bleached to retinal and opsin, and this will be the initial stage by the light adaptation curve, since that the light or the rods are much more sensitive. So the rods saturate once the light is moderately bright. So as in the experience or in the experiment, then when we increase the background illumination, this will lead to the saturation of the rods, so that the rods are no longer, they can decrease their sensitivity, and since there the cones start to or continue to adapt and respond to brighter illumination. So as we increase the brighter illumination, the cones can detect the difference between the background and the test stimulus, which reach maximum about 5 to 10 minutes. So this is the light adaptation curve. Please, if you have any question, let me know in the chat box.